my vet is like 24/7 available and making sure nothing is wrong with my pet. And that's right there, it's peace of mind that pet owners have actually been wanting for forever, right? So it's a really great feedback, and when they realize this is a reality, they want it for life. It doesn't matter if it's a healthy pet, if the pet is fully recovered from surgery.
Welcome to the Pet Care Report podcast by Pet Summits. Here's your natural dog healthcare host, Alora McKinley.
Well, welcome back to the Pet Care Report. Now, I'm sure I'm not the only pet parent that has Googled my dog's symptoms late at night and freaked myself out with all the possibilities. Now, what if we could get proactive, quick, and affordable care from a trusted vet without even leaving our home? Well, it is possible. And to tell us more, I'd love to introduce you to Guilherme, who is the co-founder and CEO of Maven Pet, an innovative venture combining AI and human expertise to monitor pet health around the clock. A passionate advocate for animals, he firmly believes in the essential role pets play in our lives. Through Maven Pet, he aims to ensure every pet owner has peace of mind about their beloved companion's well-being 24/7. Welcome to the podcast.
Welcome. Thank you for having me. It's really a pleasure to be here.
Well, I'm really excited to learn about Maven. Can you tell us a bit more about how it works for pet parents?
Yeah, sure. So what we built at Maven is a system capable of digests hundreds of data points from different sources. Okay, so from a smart collar, from a mobile app, from PMS, which are softwares that practices uses, and it's really able to understand early and detect early the onset of health issues on pets. Okay, and so for the first time, pet owners can have the peace of mind of knowing that their vet will be able to understand early on if something is wrong with their pets and tackle that from day one, right? So avoiding further on more complex and complicated situations, spending more time and money on diagnosis. And so it's really the first time that we can be proactive towards our pet's health.
And how do we use it? Is it something that gets injected to our dog's skin, or is it on their collar? How does it work?
Yeah, so it's one of the ways that we collect data. It's obviously through a wearable that goes into each pet's collar. Okay, then there's also a mobile app where we keep collecting more data and we follow up with a pet owner through virtual checkups. The pet owner can send their vet any relevant information they see about their pet, and we are working towards integrating with more data sources. Okay, to really build this comprehensive system that knows each pet better than anyone else, right? And that's the reason and of our ability to detect early if something is wrong. So not only the sensor, but the mobile app, other data sources are crucial so that we can build out and support through data our understanding that something is wrong with the pet and send that information back to the vet, so helping them streamline diagnosis, streamline treatment as well.
That's so interesting. And is this something that an existing veterinary practice can implement and be involved with?
Yes, of course. We are currently working with several hospitals, practice, rehabilitation centers, mobile vets across the world, actually, not only in Australia, United States, Canada, UK. And it's something that we've built so that very easily and almost effortless, any practice, any staff member can start using Maven on their patients and can start having real-time data about their patients and can receive these alerts when something is wrong so that they can follow up immediately with a pet owner. Okay, so our goal is to bring technology and to bring data so that we can empower staff members at the practice to have better care, right? So to proactively understand early on if something is wrong with one of their patients and follow up with the pet owner as they see fit. Okay, so Maven is this software and data provider for the practices so that we can shift from a industry that is based on communication, is based on perception. We are depending on the pet owner to realize that something is wrong, towards a more data-driven approach where we do have data and technology to understand early on nuances and changes on the pet behavior that might indicate that there's something wrong.
That's awesome. That's great. It's available in so many different countries. And what are some benefits that the vets are seeing by using Maven with their patients?
Yeah, so we have a bunch of different use cases. Okay, so to start with post-surgery follow-up. Okay, so after the surgery, pet parents go home with a bunch of guidelines. They need to restrict the pet from exercise. They need to keep an eye. They need to have the collar on the pet, making sure the pet is not licking the wound, things like that. But we are busy, right? So we don't understand these nuances in the pet behavior. And so through our sensor, through our technology platform, we can have real-time feedback whether the pet is smoothly increase the activity, the pet is recovering well, the pet is sleeping well, right? So now the vet has that information, okay, accessible, but more than that, they know that our system will trigger if something is wrong, right? So if a golden retriever that just went under knee surgery suddenly is super excited in the middle of the night, okay, the vet will receive an alert so they can follow up with the pet owner, making sure they are following the guidelines, right? Or if the pet is being restless in the middle of the night, okay, that might indicate there's some discomfort with a wound, or the pet is trying to lick the wound. And so now the vet has that information and doesn't need to wait on the pet owner to realize that something is wrong, or doesn't need to keep calling every single day to make sure the pet is recovering. Now they have data telling them when actually something is wrong. So that's just one of the use cases. We do also have a lot of chronic patients. Okay, they are under some sort of medication, for example, diabetic patients, heart failure patients, where it's crucial to understand the worsening of the condition so that we can very soon change the medicine and making sure the pet is stable. Okay, and so from diabetes, we can tell if the pet is getting lethargic. We can tell if the pet has been vomiting. We can tell if the pet has a worsening of the eye condition. And all those signals are important signals that might indicate there's a worsening of the condition, right? Now the vet, when this happens, the vet knows immediately. They can call the pet home, the pet at the clinic again. They can remeasure blood sugar. They can do tests again to make sure the pet is stable. Okay, the same thing on heart failure. Okay, so one thing to keep an eye on a pet with a heart failure is the changes on respiratory rate. Okay, within our system, we can tell those changes. Okay, and I can inform the vet that suddenly there was an increase on the respiratory rate for this patient, and that's crucial for us to act early on to avoid, in some scenarios, unfortunately, death of the animal. Because by tackling things early on, when the moment they happen, is the best way to ensure each pet is safe and healthy 24/7. So these are just some of the cases that we work with our clients towards, but even healthy pets. If you are just a concerned pet owner, your pet is getting older, and you want to keep an eye on it, you want to make sure that you realize things early on. We also have a lot of pets that are just healthy, but we know they are prone to develop some sort of issues, right? And so we also have a lot of healthy pets within our system where we can detect early joint discomfort, where we can detect early arthritis, where we can detect early, again, diabetes, liver disease. All those sort of things are use cases where really leveraging data can help vets and pet owners tackle problems day one. And that's the best thing to do if you want to make sure the treatment is effective and we don't let it get to a later stage where there's basically nothing you can do at that moment.
I was just about to ask about like complex medical issues, because that could be quite hard, especially if you're using technology to play a role in that. Now, how has it benefited pet parents?
Yeah, pet parents love it, right? So when a pet parent receive a phone call from their vet or for the staff member on the practice, they go to calling them and saying, "Hey, you've been doing an amazing job with Tommy. I noticed that you are slightly increasing the exercise. That's exactly what you should do. Keep up with it." The pet owner mind click. They realize, oh wait, my vet is actually looking at my pet's data. My vet is actually on top of my pet and making sure everything is okay. Okay, and then that's peace of mind that doesn't exist anywhere else, right? So we pet owners worry all the time about our pets. We have no idea what's going on. We wonder all sorts of things. Is the exercise enough? Is he in pain? Is the diet the appropriate one? And now they know their vet is doing that for them, right? So now they have the peace of mind. They don't have the burden of the bad things of being a pet owner, because their vet is in control of their pet's health, right? And so that's peace of mind that doesn't exist anywhere. So we freak out for things that are not relevant, and now we know I'm sending all the information back to my vet, and they will reach out to me if something is wrong. Okay, not only when things go okay, but also when things go bad, right? So if we notice that the pet post surgery has been more excited than they should, okay, I also incentivize vets to pick up the phone and call the pet owner and tell them, hey, look, we noticed that your pet might be exercising more than they should. Please try to find ways to restrict that. Otherwise, we could have post-surgery complications, right? The wound could infect, or depending on the surgery, there are a bunch of complications that could arise from. And so both ways, the pet owner realizes, okay, I have like, my vet is like 24/7 available and making sure nothing is wrong with my pet. And that's right there. It's peace of mind that pet owners have actually been wanting for forever, right? So it's a really great feedback. And when they realize this is a reality, they want it for life. It doesn't matter if it's a healthy pet, if the pet is fully recovered from surgery, they want to have this they want to keep the service, because they realize pets can have all sorts of complications. I mean, nowadays, healthy pets, unfortunately, it's a rare thing. And so they realize that tackling things early on is the first step towards ensuring your pet is safe, healthy, living their best life. And you are also increasing the lifespan of your pet, right? So everything that we want is as many years as possible with our furry friends. And so tackling things early on, it's crucial.
Sounds like this is going to save parents quite a lot of money, just going maybe to emergency vets if they're worried late at night, or just going to lots of different vet appointments.
Exactly. There's also a financial side to it, both for pet owners, but for practice as well. With the pet owners, of course, they will only be called to the vet if there's actually a need to go there, right? And that it will be their vets telling them, please come to the clinic. We found A, B, or C. We should do X, Y, Z exam. But at the same time for the clinic, because they are not spending as much time on a complex case, okay? Because they streamline it. They have data to streamline diagnosis. They are treating things early on, and that leaves them time to focus on things that really matter, right? That's also a massive advantage for practices to start working with Maven. We really streamline their work on diagnosis, on treatment, on spending time on cases where their experience or expertise is not required at all. And so that's also part of the feedback that we have.
Yeah, that's great. And is this something that is used only on dogs, or can it be used with cats as well?
Both cats and dogs, yeah.
Okay, cool. And how does AI play a pivotal role in your product?
So we do use AI on different ends of the product. Okay, so the first thing that we did was infer the knowledge of our clinical team into a rule-based model. Okay, so everyone knows a senior pit bull, it's getting older, slightly obese, it's getting lethargic week after week. Okay, everyone knows, every vet knows, everyone in the industry knows it's the beginning of some sort of osteoarticular disease or problem, right? The thing is that so far no one has been able to detect it. Okay, now through data we can, and so that was the first step in terms of AI. Today it's more complex. Okay, so we have what we call algorithms that detect abnormal changes on a pet behavior. Okay, so just for you to have an idea on the sensor, each day we have close to 1 million data points that maps out the behavior of that pet. Okay, and then what we are looking for is changes and slightly changes on that pet behavior and what that might indicate clinically speaking, right? Because a pet being lethargic, or a pet being less intense, or a pet being restless in the middle of the night, or a disruption on sleep patterns can mean different things, right? So that's why we need all the other data from the PMS systems, from the mobile app, to really help clinically understand what's wrong with that pet, right? Because being lethargic could be a flare-up of allergy, or could be a flare-up of a arthritis problem, or it could be normal. Okay, and so we really need the other data points to get a better sense, and that's where AI kicks in as well. Okay, so our AI is this system that it's dynamically interpreting data from different sources and also sending questions back to the pet owner, so then we can go down the funnel of what might be wrong with this pet until we get to some certainty, and then send that information back to the vet. Okay, and again, when we send the information back to the vet, okay, it's not data intensive. Okay, they don't need to look at charts, they don't need to double down on data themselves. Okay, I'm already leveraging again AI, so I can tell them exactly what I found out from a zoomed out perspective, so that they can tackle things from day one. Okay, so I will tell them this pet has been lethargic, there was a disruption of sleep pattern, there was vomiting, we know based on medical records this is a diabetic pet, and there's a worsening of the eye condition. So I already tell them, clinically speaking, what I found out within my data structure, within my data system, and AI also plays a crucial role on that. Okay, and I mean, everyone is talking of AI, so there's so many opportunities out there for us to keep building this AI vet, to keep building technology to so that at the end of the day we can increase the quality of care, the quality of treatment, and streamline the works for the staff members out there.
It's just amazing. It just blows my mind how far technology has come. So this is something that you are constantly updating as technology improves?
Yes, I mean it's a constantly work in progress. And as we gain more scale, I can one super interesting thing for me is to bring knowledge to the industry. Okay, because unfortunately data hasn't been the most available thing in the industry, and so we lack a lot of knowledge. Okay, so if we ask different vets how they feel about post-op surgery from a neutering, okay, different vets will have different perspectives. Okay, some will say after 2-3 weeks the pet is back to normal. Some will say it will take 5 full months. Okay, and as we scale Maven, as we have more data, as we have successful cases and cases that led to problems, we can start to build this knowledge in the industry, right? And so when we get there and we are close to have this kind of scale, I can know what's an ideal recovery for a 5-year-old Labrador that went for a knee surgery. Okay, now I know how the recovery should look like, right? And so I'm comparing this specific Labrador with thousands of other Labradors that I have within my data system that are similar that have similar pet profiles and went under the same surgery, right? And so I can know and I can build what's expected for this specific case. And that when we get there, we enter a super interesting phase on the industry where we're just building knowledge that no one has today, right? So you go home, I'm talking about always post-surgery, but you go home, if you have a pet diagnosed with diabetes, you go home with a bunch of guidelines, look for signals A, B, and C. If you find X, Y, and Z, do whatever it is. And it's really complex for pet owners to follow those guidelines. And the vet is completely blind at the practice with no idea what's going on with that pet. Okay, and through data, through a solution like Maven that remotes monitors the pet 24/7, we can really change the outcome here. And so this AI is, it will always be something that we keep develop, that we keep feeding information, that we keep learning from the use case that we have, and I think that's really the interesting thing about Maven.
Wow, so I can imagine so much work goes into keeping Maven up to date. From a cost perspective, is this fairly cost effective for pet parents?
No, so actually. We work directly with the practice and the hospitals. Okay, and so they have, for each patient, they have active on our software. There's a fee they pay to us. Okay, but this peace of mind service or this early detection of illness service that practices now can give to their patients. Okay, they are charging around $19 US to their clients. So for the price of 4 cup of coffees, you have peace of mind knowing that your vet is on top of your pet's health. And so it's super accessible. It's cheaper than a pet insurance, for example. And so people just do it. People want to have that kind of peace of mind.
And I think that's so important these days. You know, the cost of living is getting more expensive and people are having to cut back maybe on their pet insurance. So having these little things that may be able to help their pets is really important. So then for our pet owners that are listening, What's one tip that they can take away from this episode?
I mean, I really, and at the genesis of Maven, it's my personal experience, right? So I had a dog called Tommy, mixed lab mixed with husky. Okay, so a big breed, slightly obese, like unfortunately more than 60% of pets are. And the moment I realized that something was wrong with Tommy, it was when he was barking at me, so I could help him stand up. Okay, and so obviously at the super later stage, and there was nothing I could do about it, right? And so I think the key takeaway that I want pet parents to go home with is that we can detect things early, right? It's possible to detect the early signals of arthritis. It's possible to detect the early signals of diabetics. It's possible to detect the early signals of separation anxiety, okay? And that really changes the outcome of pet care, okay? If our diabetic patients can still see today, it's because we managed to detect early on the beginning of diabetes. If our senior pets and arthritis pets can still stand up by themselves and walk and can still follow the owner and can still go on a walk on the weekend, it's because we detect the beginning of osteoarticular problems early on, right? And it really makes a difference, okay, on everything. Being able to detect things early can really change the outcome of our pets, right? And I missed that opportunity with one of my pets, and that's why now we have several hundreds of use cases where actually we changed the outcome for care for that pet just because we were able to detect early on when things were wrong and because the vet was able to treat that from day one, okay? And treating thing 6 months ahead, it's completely different than wait 6 months and then treat for that, okay? The treatment is different. The efficacy and the efficiency of the treatment is different. The cost of the treatment obviously is different. And so it's only a beneficial way for everyone involved in this, from the pet to the pet parent to the vet.
So important, is it? Prevention and early detection really makes a huge difference, and you're using technology to do that, and that's really wonderful. So for pet parents and vets, where can they find out more about Maven?
Yeah, you can go to our website, maven.pet, as simple as that. You can reach out to me directly. My email is g@maven.pet, as simple as that. And yeah, every week we onboard new practice, new clinics, new hospitals to our solution. Everything is super seamlessly to integrate. You can start using it like in just a couple of days. It's really the time of us sending the sensors to your practice. And if you are a pet owner and interested in having this peace of mind for your pets, make sure you tell your veterinarian about Maven, and they can reach out and give you a try super fast.
Lovely. That's great. Thank you so much for coming on the episode today.
Thank
We'll
you.
put links to everything in the show notes so all our listeners can easily access it. And for our listeners, if you want to follow, subscribe, leave a review if you found something interesting, this helps us reach more pet owners who might benefit from this information. Thank you so much, and we'll see you next time.
Thank you.